Hello and welcome to the ALS United Mid-Atlantic Goals podcast. I am Tony Heil with ALS United Mid-Atlantic. And if you've listened to some of our recent episodes, you know we talk about ALS from every perspective, from researchers to people living with ALS, caregivers, and other groups that we're collaborating with to support the ALS community. Today, I'm really excited to introduce my friend Laura Ness. She is with Hearts for Home Care, and home care is an important topic for our ALS community. If you have been involved with our organization over the last 30 years, you know that our Howard I. Abrams in-home care program has supported hundreds of people with ALS over those 3 decades to get the home care they need for dignity and safety and better health. And Laura's going to talk about the importance of home care, how you can be a home care advocate, and what we can do together to improve healthcare for everybody. So she's doing a lot of great work on the state level, federal level, up and down everywhere, and she is very, very busy. So she makes me tired while following her work, and hopefully we're making her tired when she follows our work as well. Laura, thank you for joining today to talk about home care.
Thank you. Thanks for having me. I'm happy to be here.
So I think a lot of people don't know too much about Hearts for Home Care because it is relatively new as an organization, but you're not new to it. So tell us, what is Hearts for Home Care?
Sure. So Hearts for Home Care is an advocacy organization dedicated to increasing access to home care services. It was founded by and grew out of Beata's government affairs program, but we found that in order to have a larger impact of what was going on in the world and get more people to be advocates and have them kind of come to the table with us, that it would be advantageous for us to be our own separate advocacy organization. So we launched officially in January of 2023, and today we have over 7,000 advocates across the United States, and we work with our national and state home care association partners to really further increasing access to home care services, both nationally and in our state governments.
And you've been working in home care advocacy and in home care in general for many years now, right? You didn't just start in 2023.
Absolutely, yeah. The team that is comprised of Hearts for Home Care has been doing this for 15 years plus. So we take all of that experience and now we're transferring it into a separate organization and growing our advocate base and providing education tools and advocacy opportunities for any advocates that wish to join us. And it's an organization that is free for individuals to join, and we try to provide opportunities and education on a regular basis to connect them with their legislators and provide them that voice and platform.
And from my work meeting with other state legislators and members of Congress, there seems to be a greater understanding of the importance of home care. That's what I've witnessed. Have you seen that there is a greater understanding of home care from lawmakers these days than when you first started?
Absolutely. So when I first started in home care advocacy, I would meet with some state legislators and they thought that home care meant repairing roofs or washing windows. And so we really had to start from the beginning with folks and talk about, some of the basic education of what home care is, the value that it provides to their community and to their constituents. And we've done that consistently over the last decade and a half plus. So legislators are beginning to understand the value that we provide, the services that we provide, which we're so happy to see. And we've done that kind of through our 3-prong approach, where kind of, we think of it as like a 3-legged stool. Each leg has to be as strong as the other in order to keep the stool standing. So we do that as staffers through our direct lobbying efforts. We do that through engaging with our advocates and our grassroots piece. And then thirdly, we do that through earned media and through ensuring that the general public knows that home care exists as well and how important it is to the health of our states. So those are kind of the 3 ways that we achieve that.
Yeah, I think I've learned a lot about home care since I've been here the last 15 years. My grandfather had ALS and he didn't really access it. So I know that it would have benefited him greatly. It would have benefited my grandmother greatly if they had really sought home care and been able to use it at that time 20 years ago. So how are you helping to educate patient families and others who need home care about what those benefits are?
Right. So We talk about kind of we start from where they are and talking about
Mhm.
what needs they currently have, and then kind of relate that to not only what they're currently receiving perhaps in the home, whether that be an aide coming in and assisting with activities of daily living, so that's like bathing and toileting, getting folks out of bed, getting them their meals for the day, really those core tasks that help people stay in the community for as long as they possibly can. And then also introducing them to other options as their disease may progress, or they may know other folks that need kind of a higher level. There's shift nursing care, where we have nurses come in and provide shifts of care, meaning that they are coming in on a regular basis to observe and analyze the individual, to assess the individual, to provide assistance with maybe breathing treatments, or in some cases infusions, or doing different therapies in the home. There is so much that can be done in the home these days as a result of the advances in medical technology. In the 80s or 90s, in order to be on a ventilator, let's say, it would take up half a room or even more space than that. But today, that technology has progressed. So it's gotten smaller and smaller, and luckily more affordable for people. So it's enabled them to stay in the community, not have to be in an institution, be able to continue to contribute to their community, just with some additional assistive devices for them, and having the proper individual there to manage the ventilator and or the G tube, or things that will help them live as independently and with dignity as possible.
And from my experience working here and other forms of healthcare, I think that a lot of people just want to be in their home. Nothing against nursing homes necessarily, but most people don't want to be in a nursing home. That's not their goal. So when you're talking with patients or others who have a disability or a disease, their goal and their family's goal is to be in the home for as long as possible, right?
Absolutely. So, we believe very strongly in the continuum of care. So, there
Mhm.
are folks that may need to be in an institution, but we know there's an awful lot of folks that don't need that super high 24/7 level of care. And for that population, they want to be at home, they want to be in their communities, and it is possible to do that with a great amount of quality, and a great amount of support. And we know that not only is that where folks want to be, as much as possible, but it's also the most cost-effective option for our state governments. People being in their homes, they continue to contribute to the tax base, right? Because they're getting their groceries, the lights are on in their home, they're taking care of their yards, or the various pieces that it means to kind of be a part of society. And on top of that, just the actual physical cost of the care is much less than it is in institutions. So we really see it as a win-win proposition. It's where folks generally want to be. And, as far as our state legislators and their requirement to fund home care services, it's the most cost-effective option that there is out there.
And I've been talking with our legislative partners in our states of Pennsylvania, New Jersey, and Delaware about how home care is also a housing issue, right? Because housing is so expensive these days. It's very expensive to move, and being able to access home care in your different geographies means that you're able to stay in your home and not have to move, which is a massive expense. So, have you guys seen that home care and access to it is also something that's a solution to some of the housing issues?
Absolutely. So we see, we have folks that are specialized in social work that help people get into the housing areas that they need. There are programs within the state to help modify homes so people can stay in them longer, whether that's adding a ramp or some sort of kind of lift to get upstairs, or even just simple things like hand grabs in bathrooms and in showers. So there's a lot of small things that can be done to make sure that folks can live in their home as long as possible. But I think the other great part about home care is, although we call it home care, it's really about being in the community. So that might mean that you are living in your daughter or your son's house, or in a personal care home, or kind of a group home where folks are getting additional individualized assistance to be there. So there's a lot of different options, but the important part about kind of all of those pieces is that it's really patient driven. So that means, we understand as home care providers that we're going into someone's personal space. So we really have to be cognizant of that and everything that entails, whether it's the family dynamics or just the individual, needs and pieces of the home atmosphere there, and be sensitive to that and be able to deliver the care that we need to do, but in the context of patient choice and doing it in a way that is conducive for the patient. So that might mean if you're providing meals to an individual, that aide is learning a dish or two to cook that is, of that individual's background and something that means something to them. Or, maybe the shower isn't done at the same time every day because the client's just feeling a little bit tired that day and wants to do it an hour later and have a little bit longer in the morning to get up and get themselves awake. We all have those kind of days, and we as able-bodied individuals kind of are able to flex our day as we see fit. But oftentimes if you're in an institution, your shower time is your shower time. So in home care, there's so much more independence and dignity associated with it, and it's really much more patient driven to meet the needs that they have and also meet their goals as well.
And it's not just patient driven, it's also caregiver and spouse driven, right? Because we know from the grant funding and other help we give to people with ALS and their family caregivers that we're able to provide some respite. Even if it's just one day a week for home care, it's not always a consistent number of hours because of what they need.
Right.
You see from your experience that home care can provide a great relief to family caregivers and spouses.
Yeah, absolutely. And it's so important to be able to work with them, on behalf of the patient and on behalf of those clients. So, the folks that need to be kept in the loop and understand what's going on do. So we work very closely with families to make sure that, we're delivering the best care possible, but that we're also including them in what's going on, and making sure that they know that they're part of the solution, and also providing some support and giving them some relief, because it's a tough job to be a family caregiver on a regular basis, and sometimes just giving those families a little bit of grace is goes a really long way.
And I've said bluntly, unfortunately, for some people, they may only need home care for a few months or a year. You guys probably, either you or the other home care agencies and organizations and workers, those are some sensitive conversations to say, hey, let's look at your long-term plan here so that maybe this is a bridge, or you're not making drastic decisions, so maybe for the next year you need home care. Do you see that home care agencies are able to handle those sensitive conversations with the family about this might be a short-term solution?
Yeah, absolutely. And that's so important to understand the needs of the clients. A lot of these home care agencies have a nurse that goes out and does an assessment and kind of comes up with some recommendations that they then have that conversation with the client or with the family. And it runs the gambit. There are, a lot of home care providers even provide pediatric care, which I know is not, related to ALS necessarily, but there are nurses and home care providers that stick with a client for 30 plus years, and are able to grow with them and even get them to a place of not only stability in their condition, but in some cases able to wean them off of a G tube or a ventilator. But then there's also cases, whether it's hospice or whether it's conditions like ALS, where they may just need some respite care, or they may need something more short term. So having those conversations in a responsible way and sensitive way is, of course, something that the industry is very aware of and tries their very best to do. And even in the advocacy world, we try to understand that but things may be too raw or just too much for folks at any given time. So we try to, one, make it as easy as we can to get their voices heard, provide them templates or scripts, whatever that looks like, but also to just be sensitive that sometimes they just may need a minute, and they just may need to step away from things like advocacy and come back to that later when they feel better about it and have a little bit more space for that.
I know some of our families and patients who have ALS have had the same home care aide or worker for many years. I know some people, and I don't want to say their names, but they have had the same person helping them for 5 or 10 years if they've been living with ALS for a longer time. And those relationships really help them trust that person. It really helps them to know that that person is going to keep them safe or attuned to their regular needs. And it's not just healthcare needs. It's like their regular needs that they need to see this TV show every week,
Right.
or their need that like we need to get out to this ball game every month. Like people have needs beyond just basic food and water and sleep.
Yeah, absolutely. And it's so funny because these folks in many aspects become almost part of the family or an extension of the family. But the really kind of cool part about home care is when you have those long-term relationships, I've seen it where nurses or aides can like look at a client and see them sneeze and know what's going to happen, and know that they're getting a cold or that this is happening, and be able to stage those early interventions and ultimately prevent hospitalizations. We're like the only aspect of healthcare that is consistently in the home, whether that's just, once a week, like you said, on the respite side, to, every day or twice a day. It's, you get to know those clients and their condition and what's normal and what's not normal so much more so than any other aspect of healthcare. Even when you're talking about appointments with doctors, the most that you're going to get, right, is like once a month at the and that's the really high end of a doctor or physician seeing you on a regular basis. For a lot of these folks, that's such an essential line to be able to have an individual notice when things are going wrong and keep those individuals as comfortable as possible, but have them have that level plateau if at all possible, and keep them at home and in their communities with their loved ones as long as possible.
That's a very good point. It reminds me of the TV show I've been watching, The Pit, showing the emergency room issues and the real life uh, issues that are going on in hospitals right now. It's both complicated and time consuming and expensive. So, more than both, it's a lot of issues happening in hospitals. And we know with people with ALS, if they have a health issue, they may end up in an emergency room because of their sensitive health conditions with ALS. And as you kind of pointed out there, home care aides and workers can be the ones who prevent people from having to go into an emergency room because they can see problems earlier, maybe stop issues like choking, or they can address something before having to go to a doctor. So they can be a safety issue and a cost saving issue for having to keep people out of an emergency room situation. Is that
Yeah.
what you're talking about?
Absolutely, it's twofold, right? So it's preventing the an incident from happening altogether, and then also staging those early interventions so they don't have to go to a much more costly institution or setting like an ER. If they can navigate that at home, it's wonderful to see that kind of impact. But the challenge for the industry, of course, is quantifying that, because you don't know how many things you prevent on a regular basis. But we know those folks who are in the home every day, they're really the heroes because they are doing that day in and day out.
Yeah, it's like my mechanic can fix my brakes and tell me that it stopped me from having a car accident, but I don't know that because I haven't gotten into a car accident, and that's sometimes hard to prove the case otherwise. But you're trying to prove the case of the effectiveness of home care and the importance of it through advocacy. I saw that in Pennsylvania, you just had one of your largest advocacy days ever in Harrisburg. You brought more people than we have legislators, right? So tell me about that experience and how many people attended.
Yeah, it was a tremendous day. So, Hearts for Home Care partnered with the Pennsylvania Home Care Association, and that's an organization that represents all home care providers in Pennsylvania. And together we had over 400 people, so almost twice as many people as there are Pennsylvania legislators, come together as one united voice and talk about the needs of the industry so that we can keep more patients at home and make sure that the people that we do have at home are getting all of the care and hours that they need, and getting that from a quality individual and provider, and with the intense amount of training that we pride ourselves on providing, so folks can stay at home as long as physically possible and live their lives to the fullest. So it was a fantastic day. We heard some great feedback. We had some great legislators speak at our press conference, and we're excited of the momentum that we've been able to build from that, and we really hope that folks continue to join us in this advocacy efforts, and join Hearts for Home Care, and tell their legislators themselves the impact that home care has on them and their family members, and that it's important that it's funded adequately.
Yeah, exactly. And I saw that those photos you posted and the videos from Harrisburg, you have a lot of diverse opinions and perspectives on home care. And by diverse, I mean you have home care aides, and you also have people with various disabilities and of all ages, right? So you didn't just have some perspectives on home care. You had a lot of different takes on it coming into Harrisburg. Like, what kind of people come and advocate for this issue?
Yeah, we did. It was tremendous. So we had a whole variety of folks. We had parents of medically fragile children. We had medically
Mhm.
fragile kiddos there. We had individuals with physical disabilities there, and with intellectual disabilities come. We ran out of steps on the main rotunda in terms of being able to fit everybody in for a group photo, which is a great problem to have. But we had nurses there, both those who supervise individuals in the field. We had nurses that are actually providing the care. We had aides there, whether it be personal care assistants or home health aides. There were some physicians there and social workers, physical therapists that were there. It was just a tremendous representation of the home care community at large. And then, of course, we had folks that are in the office that are coordinating the care and scheduling the care, and folks that are interacting with managed care organizations and helping to make sure that folks are getting the care that they need from an insurance perspective. It really ran the gambit. So it was wonderful to see everyone there and really speak to the fact that we need to fund the front lines. That was our kind of theme, and that home care works, and come together to tell our legislators to really prioritize home care funding. So the Commonwealth of Pennsylvania can be healthy from both a healthcare perspective as well as a fiscal perspective as well.
And you're not just doing this in Pennsylvania. I know that you had bipartisan support, wide range of legislators that you met with, and you're also doing that in states across the country, right? How many actions have you taken this year? I mean, we can't even count them, but I've seen you or your colleagues all over the place this year alone.
Yeah, absolutely. So on our website, I know we have a list of the number of actions as it tallies up, and I don't know the number off the top of my head, unfortunately, but we've had advocacy days so far in Florida and in South Carolina. We have one coming up May 15th in Delaware, and I believe May 7th in New Jersey. We have one, I think it was May 14th in North Carolina coming up. So they're all over. We had one in Missouri already. So they're really happening all over the United States, and it's a great opportunity to showcase the importance of home care in the community, because home care is still one of those things that, although legislators are beginning to know what we are and who we are and what we do, it's still a discipline that is relatively invisible. We don't have large physical buildings in legislators' districts like hospitals or nursing homes do, or even schools. So when legislators are driving in their communities, they don't see us. We're tucked in behind strip malls and business parks, and we're really in people's homes, right? So it's hard for legislators to, remember who we are and what we do. So our advocacy days always serve as a great opportunity to come together as an industry and physically show the impact that we have and the number of people that are involved in home care in their states.
And I know that a lot of those people who are state legislators today, they become members of Congress later. You mentioned the Delaware Advocacy Day. We participated in that last year in Dover. And if you ever advocate in Dover, you know that the building is about the size of my house, which is not big. So, like, you turn around, there's another legislator, right? So, but it was very powerful, and it was nice because our person with ALS who came, Craig, he was recognized by the state house and state senate. He just went down the hall. It was and very convenient, and it's much more accessible than the Harrisburg building, that's for sure. And it's another issue altogether. Um, and so we met with then state legislator Sarah McBride, who's now a member of Congress. So those stories of home care on a state level end up being elevated up to Congress as well because of the long-term advocacy that you do.
Yeah, and that's really what we found over time too, with doing this for about 15 years. I've seen a number of folks who started out as state reps or state senators. Like in Pennsylvania, we have Congressman Schmucker, right, who is now a congressperson. Madeline Dean started out as a state rep, and she's now a congresswoman. There's so many folks that are going in that direction. Even, in Pennsylvania, Governor Josh Shapiro started out as a state rep, and now he's governor. So it's so important to build these relationships, when they are at the local level or county level, or as a new representative or a new state senator, because oftentimes they do grow into bigger roles, and they kind of elevate themselves up and go up that career ladder, so to speak. And we know that we have a home care champion kind of built in when they get to those different levels, and we're able to continue to have those conversations, and then also re-educate them, right, of what now is their responsibility or what now they have the ability to do. I know in Pennsylvania, like with ALS, right, like there are some dollars going towards research and helping on that level, but the opportunity for those research dollars is much greater on the federal level. So, when they're at the state level, you may be talking to them about increased reimbursement rates or creating pilots to support ALS. But when they get to the national level, that conversation may change and may talk about, NIH or, National Institutes of Health research funding, and, getting onto the Medicare listed of diseases to be approved for, disability or Medicare or those kind of pieces. So there's different opportunities when you're at different levels of government, and already having that relationship established really helps you get a foot in the door to be able to educate them on their new opportunities that they have to support you.
Yeah, it's a great point, especially the people you mentioned, because Congresswoman Dean, she knew one of our former board members who passed away, Wes. He passed away from ALS. And so that was when she met him in Harrisburg. Then when we see her now, she still remembers, because those stories, whether it's ALS or the kids or others you meet with your home care advocacy, it's so powerful, much more powerful than other kind of lobbying meetings that people have. And then you mentioned Congressman Smucker. He knows about State Representative Cutler's connection to ALS. So when we met with him, he starts with some knowledge and understanding of it. And that's why long-term advocacy is so important, not just one time and then you're done.
Yeah.
And so what was the experience like for your advocates? You said it was really empowering for you, but you talked with those people who have come from all different perspectives of home care, including consumers and kids and adults and parents who participated. What was their reaction after they were done?
Absolutely. So, and just a quick note on Wes too. I remember, many years ago going to the ALS lobby day in Harrisburg and being paired up with Wes and his family. And that's the other side of this too, is when you have folks telling their stories, it leaves a lasting impact not only on legislators, but the people who are also in the group with them. I think about him often, and he certainly has had an impact on the reason why I do what I do, and it kind of helps keep me going. So it's not just that impact is really magnified over time. As far as this year, our advocate experience, it was really encouraging, I would say, and there was kind of not a celebratory air, but a enthusiasm to folks that were there, because even the folks that work in home care, whether you're in the home or you're in the office, your world is so small so much of the time when it comes to the home care community. You're only interacting really with your office or your field staff that are there, or if you're in the home, you're working with that one or maybe two clients on a regular basis. And that can be really isolating. So when you have 400 people come together and have the same struggles that you have day in and day out, and be able to network and problem solve together, but also have the same message to bring to your legislators and hear from clients and hear their stories. It's really encouraging, and you know that you're not alone, and you're part of this bigger advocacy push that moves us forward. So that's a lot of what I noticed that our advocates experienced this week. We also had, in addition to just putting them into groups and having them meet with a lot of legislators, we had the opportunity to record their home care story live, and we're able to then amplify that and get that to their legislators and magnify the impact of that. We had opportunities for them to get photos with their groups and kind of be together in that sense, to do little mini interviews that we can use for social, and bring folks together in that respect. Some of our folks had connected with their legislators early and got to go on the House gallery, on the House floor, and really see just the tremendous beauty that building has. We're very lucky in Pennsylvania to have such a gorgeous state capitol. So there were a ton of opportunities to kind of be together. And then we had a great press conference where we were all together and got to hear directly from some of our legislative champions talk about the importance of home care, talk about their commitment to having our voice be heard and be prioritized, in this year's budget process. So that was super encouraging for folks to be able to hear that as well,
And
especially in this climate when you have the threats of cuts coming down from the federal government. And our hope is that these folks will hear what kind of a critical state the industry is in now, and understand that we're part of the solution when it comes to effective bending of the cost curve for healthcare.
yeah, we say that a lot with ALS care as well, because if the state, whether it's Pennsylvania, New Jersey, or Delaware, funds ALS care, because we also provide grants for home care, we work with your agencies to make sure people with ALS can get that care. And with the home modifications that we can help with, like ramping and assistive technology and stair glides and things of that nature to connect people with, then it saves the state money from long-term care costs, and it's much more efficient than other kinds of healthcare that are important. But that's where we can come in as ALS United Mid Atlantic to do that. And you're talking about how enthusiastic people were as advocates in the state level. I know with ALS and with the issues that a lot of your people are talking about that impacts them, those diseases are very taxing, and mentally, spiritually, physically. And so when you have a positive experience, that can take you on for weeks after, knowing that you're part of something bigger. That's a big gift that advocacy can have that you can't always get through other things, because the challenges of those diseases like ALS.
Yeah, we have a lot of clients that have diseases like ALS that tend to be really isolating, or, they have a very rare disease where there may be 20 folks in the United States diagnosed with it. So, having that opportunity for them to come together with like-minded individuals and folks that are experiencing similar challenges to them, it's not something that happens often for them. So, it's a great day to be able to provide that opportunity.
So, if people want to participate in further advocacy, if they want to learn more about what you're doing, what's the best way to follow and get involved?
Sure. So you can get involved by going to heartsforhomecare.com and becoming an advocate there, registering to be an advocate. We also have a very strong presence on Facebook and on Instagram, so we invite you to follow along there and be a part of the community. And as soon as you become an advocate, you'll get information from us both about what we're doing and what's going on in our various states, but also, the opportunities to impact what's going on, whether that is emailing your legislator or recording your story or registering to attend one of our lobby days or other events. And, you can become a part of the community.
Great. I know that I follow along and I learn a lot. And it's important to some of our families to see greater funding for home care because it helps all of us. So if you're listening, please make sure to follow Hearts for Home Care. It's not an endorsement or anything like that. Just it's important for our ALS community to support home care in the States. And if you want to follow our mission, please follow us at alsmidatlantic.org and at ALS Mid-Atlantic on social media like Facebook and Instagram and LinkedIn and our YouTube page where you might be finding this video if you're watching on video. So thank you so much, Laura. I look forward to advocating with you more and seeing some successes we can contribute to together.
Absolutely. We'll see you soon, either in Harrisburg, Dover, or Trenton.
Who knows, or somewhere in between.
Somewhere in between.
Thank you so much. And if you're following us, please make sure to like, subscribe, leave a message, a comment, tell your others to as well, leave a review so we can amplify for ALS awareness and for home care awareness as well for this particular issue. Thank you so much, Laura.
Have a good one.